scene is safe. Does anybody know what happened here? No, I don't see anybody, so I'm gonna call immediate EMS assistance. I'm gonna, because I don't know what happened, can you spine board her just in case she had a spine injury? Okay, so then, can you hear me? Can you hear me? No, she is unconscious. So I'm gonna check airway. And she's breathing. So I'm going to check pulse. I feel her pulse. It's low. Her breathing is fine. It's a little low, so can I get some oxygen on her? And then circulation. Can I have someone on vitals so that I can get to the other part? So I'm going to check her temperature. Her skin is cool. Her temperature's also okay. Because of the major bleeding of the stab wound, maybe she is going into shock. So I'm going to put a dressing on and I'm going to stabilize the patient, put her arms to the side, and I'm going to apply a warm, heated blanket to protect her. And I can't gather any information from her, any sample, because she is unconscious. So I'm gonna check the scalp for any other bleeding. Neck, no major bleeding in the back. Her mouth, fine, she's breathing, everything looks clear. Her chest, I'm gonna open the chest up with the clothing. Check check the chest. Everything's okay. The neck, the cervical, the trachea looks in place. The jugular veins also look in place on both sides. And let me check the cervical spine. It's intact as well, so the neck is fine, the chest is fine. I'm also gonna take a look at the abdomen. It is where the stab wound is. So it's just major bleeding. I applied the dressing. So I'm gonna palpate. And then I'm gonna palpate the pelvis. No injury to genitals. And I'm gonna palpate the lower and higher extremities to check if there's anything else. I don't feel anything on the arms. No major lacerations or anything. So that should be okay. I removed clothing from the lower extremities as well to check. Everything looks fine. So I'm going to turn her over to the side to check the lumbar and cervical. And everything looks intact. Everything looks fine. Vital signs were she had 90 to 60 blood pressure. She had pulse was high to 35. Respirations were lower than 10. So this is immediate transport. In 10 minutes it should be here and it will be transported to level 1 trauma center. And she was in shock with the stab wound. And that's my video.